The 40,000 series of CPD codes of surgical procedure performed on the digestive system, which will focus on the areas of lips, mouth, palate, uvula, salivary gland and ducts, pharynx, adenoids, and tonsils and esophagus. Also, stomach, intestine, appendix, rectum, anus, liver, biliary tract, pancreas, abdomen, peritoneum, and omentum. So, let's see the questions. Question number 1. A newborn needs to have a cleft palate repaired. His cleft palate involves the soft and hard palates only. What CPT code would you use for the palatoplasty for this child? So there are 4 CPT codes given. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, here you have to highlight this is a cleft palate repair. The soft and hard palates only repaired. So when you see the codes, the all codes are adjacent codes 42,200, 205, 210 and 215. So you can use the elimination method to find the answer. So directly go to the codes. Okay, when you go to the code 42,200, it says palatoplasty for cleft palate, soft and O hard palate only. So and O, so soft and hard palate only also included in this code. So this is the code that clearly mentioned the scenario here, that is cleft palate repair, soft and hard palate only. So the correct code is 42,200. If you see other codes 42,250, that is palatoplasty for cleft palate with closure of alveolar ridge, soft tissue only, but that is not the case. 2,210 with bone graft or alveolar ridge, that is not the case. 215 palatoplasty for cleft palate, major revision. But in our case, it's only soft and hard palate. So the correct code is 42,200. So the correct answer is A. If you encounter this scenario in a real working world, you have to go with the CPT index. So when you go to the CPT alphabetic index, go to repair, the subcategory cleft palate. It will lead you to the following code 200, 205, 210, 15, 20, 25. Again, you have to go back to the tabular list and confirm the code. So once you're done, again, you will find the correct answer is A. Question number 2. A 65-year-old male admitted to perform gastric banding. A laparoscope along with 4 to 6 trocar ports are sited through the anterior abdominal wall above the umbilicus. The silicone gastric band is placed and secured around the upper abdomen to form a smaller stomach pouch with a narrowed outlet. Tubing is attached to the band and tunneled through the abdominal wall connecting to an access port. What CPT code should be used for this procedure? So there are 4 CPT codes here. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, here you have to highlight this is a gastric banding through laparoscopy. And also silicone gastric band is placed. So you can see the 4 CPT codes are 43,000 codes. So you can use the elimination method to find the answer. Okay, once you go to the codes directly, you can see 43,634. That is continuation of previous code. That is gastrectomy partial distal with formation of intestinal pouch. But this is not the case. When you see the 43,645, that is laparoscopy surgical gastric reconstructive procedure with gastric bypass and small intestine reconstruction to limit absorption. But this is not the case. But if you see the answer C, that is laparoscopy surgical gastric restrictive procedure, placement of adjustable gastric restrictive device such as gastric band and subcutaneous port components. So when you see the case, you can see it is a gastric banding through laparoscopy, silicone gastric band is placed. So that is the exact case we are encountering. So the correct answer should be 43,770. So the correct answer is C. So if you encounter this scenario in a real working world, you have to go with the index of the CPT code books. When you go to the alphabetic index, go to the laparoscopy. There you have to go to the subcategory of gastric reconstructive procedures. It will lead you to following codes. Then you have to go back to the tabular list and you have to find the correct code. So if you find the correct code, that will be the C, that is 43,770. Question number 3. A 4-year-old child received a gastric intubation from a physician after ingesting approximately 5 tablespoons of carpet cleaning detergent. The gastric tube was orally inserted through the esophagus and into the stomach, and lavage was performed to evacuate the stomach contents. What is the correct CPT code? So there are 43,000 series of codes available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you can see this is the gastric intubation for ingesting carpet cleaning detergent. So what we have done is a lavage was performed to evacuate the stomach content. So this gastric intubation is for therapeutic purpose, not the diagnostic purpose. So you can see the codes, there are adjacent codes 752, 53, 54 and 55. So you can use the elimination method. So go to directly to the code and find the answer. So when you go to the codes, you can see 43752, that is naso or orogastric tube placement requiring physician skill and fluoroscopic guidance. So this is just for the tube placement. But in our case, we have to evacuate the gastric contents. So this is not suitable code. When you see the other code, 43753, that is gastric intubation and aspirations, that is therapeutic, necessitating physician's skill for gastrointestinal hemorrhage, including lavage if performed. So here in this physician have performed the lavage to remove the gastric content. So this 43753 is the suitable code. So the correct answer is B. If you see other codes like 43754, that is gastric intubation and aspiration diagnostic. But in our case, this is therapeutic purpose, not the diagnostic. 755 is collection of multiple fractional specimens, but that is not the case. So the correct answer is B, that is 43753. So if you encounter this case in a real working scenario, you have to go with the CPT index. So in the CPT alphabetic index, you have to go to the intubation, the subcategory gastric. Again, there will be two categories. One is therapeutic, other one is diagnostic. But in this case, this is therapeutic. So once you go to therapeutic, it will lead you to the code 43753. Then go back to the tabular list and confirm the answer. So the answer will be B. Question number 4. A 48-year-old male has internal hemorrhoids and has elected to have them removed. The ligator and alligator forceps have been inserted through an anoscope. The physician identifies the most prominent hemorrhoid and ligates it at the base with the rubber band. Which CPT code should be used? So please pause the video for a few seconds, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight this is the internal hemorrhoids removal through an anoscope. The prominent hemorrhoid and it ligates with the base with the rubber band. When you see the answers, all answers are 46,000 series. There are 250, 55, 221 and 945. So you can use the elimination method to find the answer quickly. So let's go directly to the codes. When you go to the codes, 46250 is hemorrhoidectomy, external, 2 or more columns or groups. In this case, only one prominent hemorrhoid that was ligated with the rubber band. So this answer not suitable. The second one is 46255, that is hemorrhoidectomy, internal and external, single column. Here it says hemorrhoidectomy, but in our case, the hemorrhoids were ligated. The 46221 is hemorrhoidectomy, internal by a rubber band ligation. So this is the correct answer. The rubber band ligation is used in the case. So the 46221, that answer C is suitable. When you see the other answer, 46945, it is hemorrhoidectomy internal by ligation other than rubber band. But here also the hemorrhoidectomy done by ligation, but that is other than the rubber band. But in our case, the rubber band is used. So the correct answer is C, that is 46,225. So if you encounter this case in a real working scenario, you have to find the answer using the CPT index. So go to the CPT alphabetic index. There you have to go to the hemorrhoidectomy. There you can go for the subcategory ligation. It will lead you to the code 46221. Again, you have to go back to the tabular list and confirm the answer. So answer will be 46221, that is C. Question number 5. A 45-year-old male admitted to the ward after a fall. He had 40 centimeter laceration on the anterior part of the tongue. He also has some other complexities, including lower lip contusion, due to which the physician suspects hematoma. The physician first completes the complex repair of tongue laceration and then performs an incision and drainage to address the hematoma on the lower lip. Which codes indicate the documentation for given process? So there are a couple of CPT codes for each answer. So let's pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, there are two procedures performed. So the patient had a 4 centimeter laceration, that is on the anterior part of the tongue, and lower lip contusions. So the physician suspect that contusion as the hematoma. So two procedures done. One is complex repair of the tongue laceration. Other one is incision and drainage to address the hematoma on the lower lip. So when you see the codes, there are two codes for two procedures. So all are 41,000 series. So you can use the elimination method to find the answer. So when you see the first procedure, that is complex repair of tongue laceration, you can see answers 41,252 and 41,100 and 41,800. So let's check the answers. So when you see the 41,252, that is repair of laceration of tongue, floor of mouth over 2.4 centimeter or complex. The other one is 41,100, that is biopsy of tongue anterior 2/3. So 41,100 is biopsy of tongue, so that is not suitable. 41,800 is drainage of abscess, cyst or hematoma from the dentoalveolar structure. But here is a 4 centimeter laceration repaired. So you can use the code 41,252, that is repair of laceration over 2.6 centimeter or more. So our case is 4 centimeter. So this is the suitable code. So you can select A and C and you can omit other two. B and D you can omit. So for the second part of the question, there are two codes, 41,000 and 41,015. The 41,000 is intraoral incision and drainage of abscess, cyst or hematoma of tongue or floor of mouth, that is lingual. 41,015 is extraoral incision and drainage of abscess. So in this case, the hematoma is in the lip. So the lip is the intraoral part. So intraoral incision and drainage of abscess or hematoma is the suitable code. So 41,000 is the suitable code for the second procedure. So the correct answer should be C, that is 41,252 and 41,000 answers. If you encounter this case in a real working scenario, you had to use the CPT alphabetic index. For the first procedure, you had to go to the repair, then go to the laceration, then go to the tongue. It will redirect you to the following code, 41,250 and 41,252. Again, you had to go back to the tabular list and confirm the answer. The second procedure, that is incision and drainage of hematoma, you have to go to the alphabetic index, incision and drainage, the subcategory hematoma, then you have to go to the tongue. Even though it is a lip, you have to go to the tongue because this tongue part is including the floor of mouth also. So there it will lead to the code series. We have to go to the tabular list. It can confirm that the suitable code is 41,000. So the correct answer is C. Sixth question of the 40,000 series codes. A patient underwent esophagoduodenoscopy and had multiple biopsies taken of the esophagus, stomach, and duodenum. She also had one polyp removed with hot biopsy forceps from the antrum of the stomach. What CPT code should be used for this procedure? So there are 43,000 codes available. Please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight two things. First thing is esophagoduodenoscopy and multiple biopsies taken from esophagus, stomach, and the duodenum. So one part is taken biopsy. The second part is one polyp removed with hot biopsy forceps from the antrum of the stomach. So there are two procedures done. So let's check how to code this. So you can see the codes are adjacent codes. The first code is 43,238. That answer is available in the all four answers. And additional codes are available 250, 251 and 255. So you can use the elimination method to find the answer. So let's go to the code directly, the 43,239 code. So the 43,239 is a continuation code of the 43,235. That code says esophagoduodenoscopy, flexible transoral diagnostic including collection of specimens by brushing or washing when performed. This is separate procedure. In addition to that, 43,239 is with biopsy, single or multiple. So here, multiple biopsy taken. So the 43,239 is 239 code should be coded here. So all four answers are having that code. But for answer A, only the 43,239 is available. But for the polyp removal of the antrum of stomach, this code does not include. So you have to check other answers as well. So other answers include 250, 251 and 255 codes. So let's check those codes. So when you check 250 code, it is a continuation of 235 code. That is esophagogastroduodenoscopy, flexible transoral with removal of tumors, polyps or other lesions by hot biopsy forceps. So this is the exact code to be used here, because here you can see one polyp removed with hot biopsy forceps, that is coded by 43,250. If you check other answers, 43,251, that is with removal of tumors, polyps or other lesions by snare technique. But this is snare technique, but our one is hot biopsy forceps. So this is not suitable. Other answer 43,255 is with control of bleeding in any method. But in our case, it is hot biopsy forceps method. So 43,250 is the suitable answer. For that, you can select the answer B. So the correct answer is B. If you encounter similar scenario in your real working world, so you had to use the CPT index. So in the CPT index box, you had to go to the esophagogastroduodenoscopy. For the biopsy, you have to go to the subcategory of biopsy. Then it will lead you to the code 43,239. For the removal of polyp, you have to go to the CPT index for removal. Then select polyp. In the polyp, you have to select the subcategory gastrointestinal upper. So gastrointestinal upper means that includes stomach, esophagus, those part. So it's lead you to the codes 43,250 and 251. So again, you have to go back to the tabular list and confirm the answer. Once you confirm, the correct answer will be answer B. So if you are preparing for the AAPC CPC examination, my channel will help you to solve the problems you are facing in your examination preparation. So please subscribe my channel. And if you have any doubts or any questions, you can put in the comment section, or else you can email me, or you can WhatsApp me to the email and the WhatsApp number displayed here. So please subscribe my channel and stay with me. Thank you.